much. Thank you very much for having me here. Let me see if it works. Okay, so I'm going to talk a bit about some themes that Francesco has already raised in his introduction. And what I'm going to talk to you about is aging. And in particular, the kind of work that I'm doing within this huge project, which is called AgeIt, and which is Aging Well in an Aging Society, which is a huge alliance which includes a large number of public and private institutions. They are headed by the University of Florence, and this is the vast number of participants, and it focuses on the challenges of aging. And the project has identified 10 different challenges, and so developed 10 different huge projects within each one of them, with a lot of intersection and interconnections among them, and to account for the vast interactions that these challenges raise for the societies and for the economy. And it's not a research project, in truth. It's a truly research program, we should define it. And it has the ambition of affecting and providing a huge contribution, okay, along different routes. So first of all, development of policies for the sustainability of welfare and of the society in face of the aging population that we are facing throughout the world, particularly in Italy, or at least in developed countries. And so the project aims at collecting and providing data evidence and study the relationship between aging and economic dynamics, but also contribute with innovation by providing also new results and possibly new public services. And ultimately, which is also important, to drive towards a more positive image of aging. So transform it sort of from a big challenge and a big problem to a set of opportunities which are there. And so as I told you, there are a lot of interaction and intersections among the different challenges that are studied by different research groups. And there are different boards that try to keep together all this huge mass of research effort that has been going on. And innovation and technology transfer is a key element within this project, which involves also not just universities and public and private research institutions, but also the private sectors with SMEs that are involved through bandia cascata, I don't know how to translate it in English, and a lot of interactions with stakeholders. So dissemination is key in creating and making this interaction work. And let me go straight now to one of these big challenges and one of the big branches of this huge research project, which is Spoke 9, and which focuses on general technologies for active and healthy aging. Okay, so this involves in many respects the development of prototypes and new devices and new technologies. But as I told you, there are different fields that are involved. So for example, we have architects who are focusing, it rains a lot, focusing on the development of the design of living environments which are adapt and favor prevention for the elderly. And we have also psychologists who study, for example, the interaction between these new devices and the human being, so the elderly. And we have one economist in this big project, in this big branch, which is me, and and a small team. So we focus on the analysis of the relationship between aging, so demographics, and firm dynamics in terms of innovative dynamics and innovation. So there has not been much in the literature, and this has become a very interesting journey for me. So I'm going to show you the preliminary result that with my team we have obtained so far. I'm going to tell you what kind of work we are doing and what is the ultimate aim that we are after. So I think I have to convince nobody that aging is, a big issue that has been there, for quite some time already. I have a quotation from the Standard & Poor's Global dated 2010, and it was already, pointing to the big challenges, to the big economic challenges that aging creates and generates. And, to some extent, these challenges have always been seen in a negative way, so the impacts on the health system, the impacts on the pension system, and, the problems that the shortage of workforce would generate. And so what we want to show is that there are also some positive aspects related to that. And these positive aspects relate to innovation. Now, in truth, there's not much that's associated in the literature demographics with innovation. There is some research, quite recent, so the cognitive aging literature, of course, has said that there is a decline in the ability of the human being to generate novelty. And based on that, some researchers, as you can see, is very recent, have done studies on patents and on inventions, so inventors of patents, and they have shown that their productivity in terms of patented invention indeed decreases in time. Not just that, they have also shown that the quality of that innovation tends to decrease as people grow older. Now, this is true, but to some extent, we should also consider that the aging of the population per se generates a vast amount of opportunities for firms. And these opportunities translate into markets and market areas that open up. And this is very much in line with the fact that it's true that older people, indeed, in the developed countries, I have the US and Europe as examples, but they represent a big chunk of income and spending power. So in this respect, they should be of interest for firms, and if firms want to target these markets, they have to think about, products which are aimed for these markets. So this could represent an engine towards innovation. Of course, innovation directed into a specific direction. So what we are doing is we're trying to show this. And we're trying to select and collect data to find evidence for this. So of course, the two sectors that came into our mind that mostly would be affected are of course the health sector, because the aging of the population is increasing the incidence of some diseases, for example, and also the other sector is the assistive technologies. So everything that has to do with assistive technologies. And that's because, the kind of impairments, cognitive, hearing, vision, that increases with age. And it's also likely that the more you age, the more these impairments add up. So that's an interesting setting. So we use patents. We use patents we use patent as a measure of innovation. I'm not going to discuss, there's a big discussion in the literature on the pros and cons of using patents as an actual measure of innovation. It's not a product, It precedes a product, of course, but it's a sign of innovative effort that has come to some conclusion. So we use patents, we use high quality patents. So we identify patents which have been applied at the 3 most important patent offices worldwide, so the US, European, and the Japanese patent office, which are called triadic patents. And we do first a keyword search. So our initial focus was mainly on the health sector. So we identified from the medical literature the main causes of diseases affecting people over 75. And so what we did was to take this list, derive keywords out of those, so looking for each one of them for, it was mentioned just before, for example, ischemic heart disease is the main cause, the most relevant cause of disease for the elderly. So we went into the medical literature, we found a bunch of keywords which could identify this kind of disease, and we did a keyword search on the claims of the patent. So the claims of the patents is where you find what the patent is meant for. And then we have cleaned it up by using also the technologies, the IPC classes of the patents, just to make sure that we are identified patents which are aimed at the health sector. So it's interesting to see, for example, in the left-hand side, you see that the number of triadic patent families have been increasing in time in the past 15 years. The trend is quite clear. What is more interesting is what you see on the right-hand side, which is the new entries of firms. So firms that are patenting for the first time in this group. And you see that these entries pile up, so that it's actual number of entries, so the number of new firms that enter into these sectors are increasing over time. Which shows again that there's an interest there. Then we did, we used some work that has been done previously by the World Intellectual Property Organization, which has identified patents that pertain the realm of assistive technologies, and you have both conventional and emerging assistive technologies. So conventional technologies are spectacles, for example, and emerging assistive technology are artificial eyes. So you can imagine that the AI content in this last group is quite higher. Just to give you an information, so the AI content, for example, into the previous group, the health, health bunch of patents is not that big, but is increasing in time. And we mostly identify medical devices, technologies aimed for medical devices, so not pharmaceutical. So what did we do next? So we took the firms that are applied for these patents that we identified, and we built the whole previous patenting structure of this firm, patenting history. And we built weights for each firm, depending on where these firms applied for patents to. So that each country could have a weight for the firm. So that would represent the firm exposure to a specific country. And we use this then to obtain at the firm level indicators of exposure of firms to demography, the aging of the population, for example, and a bunch of other controls, country-level controls that we want to control for. Okay, so this is how we build our indicator for exposure to population aging at the firm level, using these weights. As I said, other controls, so GDP per capita, knowledge stock at the country level. We build the knowledge stock at the firm level, and we are exploring the role of public and private expenditures in health. Then we do some regression analysis. So I skipped the details because I don't think that is of big interest for this audience. But what I just want to show you, so I have two sets of results because in economics, we're a bit picky about endogeneity, reverse causality, so we do want to obtain robust results, so I'm going to show you this one. So the effect is there. So you do see that demography, aging of the population, is driving the direction in which firms actually innovate. And this is quite, it might seem obvious, but it's quite interesting because, as I said, in the literature, there's nothing there. Now, this is where we are at the moment. I'm going to tell you what we are doing. One interesting thing is that, our firms substituting their innovative effort, directing that effort towards technologies which are aimed to the elderly, and maybe reducing their effort into other directions, which might be, from a welfare point of view, a relevant issue to consider. And so we have done some other data gathering. We have some preliminary results which we are working on, so I'm not going to show them to you. But there is some evidence that this is indeed happening. And so that there is an overall reduction effect in the innovative effort because of this focusing to this direction. Now, this is something we need to explore, for example, because we want to see how much this is connected with the complexity of the knowledge that the firms are to develop and use for innovating into these specific sectors. Because if you think back about what I was saying before, the comorbidity issue. So the fact that you have more problems that add up might translate into the firms having to deal with more complex technologies. The same is for assistive technologies with the increasing role of AI, which might force firms indeed to master more complex technologies. So it might be, what we want to show, what we want to see if there is a change in the direction, but also maybe an increase in the overall quality of the innovation that is produced and how much this is affected by the complexity of knowledge. And then, of course, we will have to dig a bit more on the role of public and private health expenditure, which is also a relevant issue, thinking about the policy implications that we might have. And I think I can close here. Thank you very much.